Hello, I'm Louise Condon, Professor of Nursing at Swansea University and also at Swansea Bay University Health Board. I'm going to talk about this project, which is Roma, Gypsies and Travellers Experiences of Cancer. And you'll notice that two members of the research team come from these communities. So Yulana Churiova is a member of the Roma community and Leanne Morgan is a member of the Gypsy community. So the aim of the project is to explore and raise awareness of cancer prevention among Gypsies, Roma and Traveller. And in this project, 6 peer researchers conducted interviews in a focus group. And in phase 2, Leanne and Yulana co-led workshops to co-produce interventions. And there's 2 interesting things about this project from a public involvement point of view. First of all, Roma, Gypsies and Travellers are a marginalised group who suffer socioeconomic and health inequalities. They're considered to have the poorest health outcomes of any BME group in Europe. They also experience overt discrimination and hate crime. So they're a hard to reach group. Secondly, cancer is a taboo subject often among this community, as in some of the BME groups. So what did the peer researchers bring to this project? I mean, in research, trust is very, very important. And in this case, the peer researchers were able to create trust, which also extended to the academic researchers and the funder. They were very interested in who the funder was. And as the Roma researchers said, because it was done by myself, then they had trust. This was when conducting interviews. They also brought a lot of sensitivity because cancer is a taboo subject. We conducted the interviews with Slovakian and Romanian Roma people in the Romani dialect. And this was an interesting quote from the translator of the Slovakian interviews. And she said, in this Romani dialect, cancer is called zungalai, which translates as ugliness, meanness, dirtiness, evil. So it's apparent how much skill and sensitivity the researchers had to use to conduct interviews and obtain data about a subject which in itself is so profoundly negative. And in some interviews, they conducted the interview without ever mentioning the word, but still managed to obtain the data. This final quote, this was an unusual interview because it was a man being interviewed by a female peer researcher. Some men didn't want to be interviewed by women. And she says here, he did get emotional. He was a typical male trying to hold it all in. But I could see from his face, you know, so he stopped for a bit. He wanted to continue to go back over a couple of things that he thought he could add. So even though the interviewee was distressed, she was able to create this environment where he wanted to provide good data and talk about his experience. So the conclusion, they weren't just recruiters. Obviously, peer researchers are fantastic to assist with access and recruitment, but they're not just recruitment. They brought lots of skills. And I just wanted to say finally that high quality public involvement does add to time and costs, like training. We did a lot of debriefs, but it is worth it. And I'm very grateful to Tenefus Cancer Care for funding this study. Thank you very much. Goodbye.